Okay, today we are reviewing hydrogels. Hydrogels were basically found in the 1950s, and they're 90% composed of water and polymer sheets. Hydrogels can be used on a variety of wounds. The most common wounds which we recommend hydrogels for are good granulating tissue beds inside of the wound. Hydrogels can also be used in wounds with slough or necrotic and devitalized tissue because hydrogels have an autolytic debridement action which allows your body to self-debride the devitalized tissue within the wound. Contraindications to using hydrogels are wounds with heavy drainage or exudates, as hydrogels are not capturing all of the exudate that's coming out of the wound, although they are hydrophilic and will absorb some of the drainage. So if you have a very mild draining wound, a hydrogel is okay. Secondly, hydrogels can cause some maceration around the peri-wound area, so you must be sure when using hydrogels to use peri-wound protectants around the borders of the wound. Hydrogels come in three forms. Hydrogels can come in an amorphous liquid form, which is easily dispensed from a tube. They can come in a gauze form, which is impregnated into something like a 4x4 gauze, and they may also come in a sheet form, which is excellent for packing rather larger wounds. Hydrogels should be substituted for dressings such as wet to dry dressings, which can desiccate or dehydrate, removing most of the moisture from the wound. Remember, we want to have a moisture-rich wound environment, which is not too wet and not too dry. Hydrogels provide an excellent environment in many different circumstances. So let's look at some of the hydrogels that we have today that we can use in the nursing facility and in other environments. Okay, so here we have a hydrogel in the aqueous form, and I'm just going to show you how that is dispensed. Normally you can take a tongue blade and apply this to the wound bed directly, but here's the hydrogel itself coming out of the tubing itself, and here's the amorphous hydrogel. If I was going to apply this to a patient's wound, I would generally take a tongue blade, apply it to the base of the wound, and then I would put a secondary dressing over it, which you can use a 4x4 gauze or any other kind of ABD pad or woven gauze that you choose, or a foam dressing. We often get asked, how long can you leave a hydrogel? If you are in a nursing facility, we recommend daily dressing changes in order to monitor the wounds. Now, if you're a patient at home and you don't have the resources to change your wounds daily, then we recommend that you may leave the hydrogel on for up to about 3 days. You must read the packaging and talk to your physician about how long you should actually leave the hydrogel on, as the wound can develop some decline over those days, and you'd want to be able to evaluate and monitor the wound itself. The second type of hydrogel that I'd like to show you, this is a 4x8 hydrogel impregnated sheet. This has the actual hydrogel impregnated into the sheet, so we will go ahead and open this package and we will take a look at this hydrogel here. This type of hydrogel is excellent for packing wounds and is also excellent for using on larger wounds where you want to just apply it directly to the wound. And you can see that it's very densely packed with the hydrogel. It's an actual 4x4 gauze, and this would take an excellent replacement of an actual wet to dry dressing that is heavily recommended in the hospital setting, but should be replaced with a dressing such as this.